Hey everybody, welcome back to Health Matters, proudly brought to you by Cipla. My name is Ryan O'Connor, and we're chatting to our good doctor, Dr. Konrad von Hagen, who is an esteemed medical doctor, not only in obviously the sporting front, but also, when he has time for it now, which I guess is more than you did a couple of years ago, Doc, but for general patients as well. You see a wide spectre of people, and one of the common things that we haven't chatted in the series so far is pain. Right. So besides what our mind says when we hear that word pain, what is pain?
Yeah. Just coming to pain, it doesn't matter if you're an elite athlete or you're general public, or pain is pain.
Yeah.
And I still treat all my patients the same. If you are a 70-year-old that walks, or you're an elite sportsman, I still use the same principles.
Got you.
So the principles I like to use is I go with the IOC, the International Olympic Committee.
Okay.
Brought out a consensus document in 2017, and it's quite a nice document that just gives you all the guidelines and stick to what is safe and what's not safe, and to keep an eye on that you follow a process and not just give anything to anything. So pain is just that unpleasant sensory and emotional experience associated with actual injury or a chronic type event.
Okay.
So it's just your body being unhappy physically and emotionally to something that's happened.
Because I was going to ask you, what types of pain do we have?
So not all pain are the same. So your normal, most pain we see, like we've spoken before about the acute ones, that is your inflammatory type pain.
Okay.
And that is the process that we manage and should be over quickly. Then you've got your neuropathic pain.
Okay.
And that is more related like neuros with your nerves. So that will be people with nervous type problems. That's where your Olympic para-athletes come in.
Got you.
And also where guys with pressure on nerves or guys with disc problems, it's a different one. And why it's important to know that there's different ways is you're going to use just different medication for all of those ways. And then you've got your chronic pain, which is a combination of theirs, and there's some other pathways that are in there as well. And there is a big psychological element going with that as well that you need to try and look at and treat. I think for today, because it's quite big, we're going to stick to the general pain for the general public and the pathways and the way we will manage that.
Speaking of that management, what are those kind of requirements? Because they're for the whole board. I mean, you mentioned that it's got to be one that covers general. It's got to be, talk us through some of those.
I think firstly, we must know that medication is only one. So we've looked at the other principles before. So we still want to do our RICE or price principles and all of the other things looking after it. But medication is an add-on. It's not a standalone.
Okay.
Then when we prescribe medicine, we want to do it at the lowest dose and for the shortest time we can.
Okay.
All medication has got side effects, but medication used in the right area for the right things is adamant and very, very important. Then as a doctor, you need to stick to your guidelines and your rules and know how much you should give and how much you shouldn't give.
Sure.
You must take into account what the other problems are. So does this person have a cardiac problem or a renal problem or stomach ulcers? So you need to take that into account on what you're going to give and how long you're going to give that. Then also, specifically in sport, we must remember, and I think we'll talk a little bit about that later, is that some drugs are not allowed. And if you give them and they're not allowed, what is the process to follow for that?
Got you.
And then very important is that you do not take medication that your fitness trainer gives you.
Yeah.
They're not allowed to prescribe medication. Sometimes they are used to, in the old days, prescribing medicine, but you don't have a license to prescribe. So if they ask you and you do have it, you can, give it to them. But the moment you take that responsibility and say, take that because that's going to work for that, then you're prescribing, and are you licensed for that? So
I love that advice. I love that. I think people are going just to go do gym on a daily basis that have personal trainers that go, man, you've got this here, just take this or take X, Y. Be very, very careful. Be very cautious. I think you as a trainer, and I think you also as someone receiving that training, please be very careful. To the doc's point, you want to get it from the right source.
Yeah.
Doc, let's talk a little bit about the meds specifically. You mentioned the fact that we should be cautious, and I've just been flagged now because I'm traveling soon. And we often forget we want to be cautious. There might not be anything wrong, but if your wife is like mine, I've got a medical kit that travels with, right? It's got everything in it, and by that I mean everything. I mean there's something for if I've got an upset stomach, or I've got just in case for some unknown reason Australia have run out of medicine. My wife wants to make sure that in my bag I'm okay. Okay, but be warned, there are certain medicines we can't travel with, obviously.
I think your over-the-counter stuff, normally you should be okay with, but there are over-the-counter stuff that is not always okay.
Yes.
So for safety, if you do travel, just get your doctor to give you a script.
Got you.
Number one, that
covers
that has been prescribed.
Yes.
So you know that that's covered, and if something goes wrong, you're not in the wrong now. If we look at the way we prescribe meds from an injury point of view, we go back to what we said earlier. Stick with basic medication, as little as possible, as short as possible. And there we will have our paracetamol anti-inflammatory combination, or separate or in combination.
Got you.
And the anti-inflammatory side, we would use things like diclofenac. Again, taking into account our medical conditions. If they're on other meds like warfarin, is it safe to use with it? Do they have stomach ulcers, heart disease, kidney disease? So the doctor needs to take that into account. If it's more severe, we want to add medication on. That is when your medication, like your combinations with your paracetamol, anti-inflammatory, and codeine comes in. Your question now, something simple like codeine, which you can get over the counter for a few. Now, if they catch you in Australia at the border with that, you will be, that is in their country, a highly legalized drug. So it's not in South Africa. So be careful with what you take over and ask advice there. Another one that we add on is something like tramadol. And tramadol is a low opioid, but it's got a strong pain effect. Problem is, in some sports now, from this year, it's a banned substance. So you cannot use it anymore. Last year you could have used it. This year you can't. So for us, we get a new update every year. We go through it. So we know which is the new stuff, what is the changes. So, and the normal doctor would not always go and look at that because it's not important in the environment. But once you are a sportsman and you might get tested, you need to take that responsibility.
Got you.
Other ones is cortisone. So cortisone orally, but also cortisone injections for pain, like in your bursas or tendons or around tendons, not in tendons. So you can use it in a lot of places, and it's got a great place for. But again, it's not legal anymore. You have to go through a process, and that's what we'll discuss. Previously, we could have given it. Now, in competition, like the tramadol, in competition is not allowed. Then there is other injectables. In the old days, you just inject your rib with local and you play. It's a different ballgame now, so we need to take that into account. I had a request from a patient of mine. I saw him in the airport yesterday, and he said, "Oh no, his son got away without the injections. He's 12 years old, came to play IPT hockey, and his toe was injured, and he wanted to inject him, and one of my colleagues must inject him because she's there." And I said, "There's no way.
It's not going to happen.
There's no way this makes sense." No, but
chance.
A typical Afrikaans father that you'll play.
He'll play. He'll do the toe. He'll inject you. Off you go.
So I don't see that as an option. And then there's the newer things like the PRP, which is not really a new thing. PRP is platelet-rich plasma. In the beginning, it was everybody was using it. Now they're more waiting. So it's something we're waiting to see where the place are. There are doctors that I know that use it with confidence. There are other ones that don't feel it really works. So it's got a place, and I think we'll have an answer on where it fits in as the studies come through. And then there are your viscosupplementation, where we inject hyaluronic acid. Sort of what all the ladies use for
cosmetics.
Yes, and you can put that, and specifically in knees, there's been good studies, put it in there, and that helps for your low-grade osteoarthritis, which is wear and tear arthritis, and just prolong the process and help the recovery. And there's good studies there to show that it does have an effect. If you want to talk about the TUE, TUE stands for Therapeutic Use Exemption.
Got you.
So if you use a drug that is on the banned list,
Yes.
you can use that
Okay.
if there is a medical condition. So
All right.
if you are diabetic, you need your insulin.
Yeah.
So you can write up on the form and say, that is why
Yeah.
this is my blood test.
Yes.
They will say, by all means, he deserves
you.
it, he can have it.
Yes.
But if you're now going to use something like a cortisone injection, which is on the banned list, you need to prove that you've done everything else. So you've done the physio, you've done the anti-inflammatory, you've done the painkillers, you've done that extended period, it's not getting better, you need to do a cortisone.
Got
then
you.
you have to apply for it
Yeah.
and do it. So now say you haven't done it. You've seen the patient the weekend, you've injected him with a cortisone, and he goes and he competes at the Ironman and oops, it tests positive.
Then what?
Then there's a retroactive.
Okay.
So then the doctor can go and fill in, hopefully all those processes has been followed.
Yes.
If those processes has not been followed,
But
you'll test positive.
wow.
So it's a very important thing
It's
for
in depth and
the
it's good.
doctors to know.
Yeah.
Because if it's not something you do every day, you're not
Sure.
going to think about it. You
Absolutely.
see a lot of people,
Yeah.
and there's one person that comes in with query gout, and you just quickly give them
Gets a
the
quick boom.
cortisone,
Yeah.
and they go and compete the weekend. They're going to test positive. You know, so.
Look, I'm really happy that there's processes in place and ones that have to be followed. And I think for the general public, just knowing some of that information that you've just dispersed with now, it's vital. Doctor, I think in closing, we hopefully will chat to you before the World Cup this year. Your eyes will be on it, no doubt. Obviously, on a fit Springbok side that's raring to go and tear the world apart again, successfully having kept our previous World Cup winning team as fit as possible and as injury-free as possible on the park. We're sitting with a Springbok captain at the moment that's we're all hoping and praying is going to be fit for the World Cup. Do you think we'll have a fit Siya Kolisi for the World Cup?
I know a little bit of the thing, but part of not being part of it anymore.
Sure.
You need to let go.
You need to, yeah.
So I'm leaving it in the
hands of the capable
hands. And I think everybody knows what's going on. Siya knows.
Yeah.
He knows what the risks are. They
Sure.
know what the risks are.
Yeah.
And they won't be stupid.
No, I know.
If he's ready, he's ready.
If he's not,
If
so
he's
be
not.
it. Yeah.
And the reality in an environment like that, you'll stand out like a...
Sure. Because it's the very best of the best.
Exactly.
You'll know.
And you'll know that you cannot keep up with what's
Yeah.
happening, and you won't be able to do it week in, week out. Obviously, his leadership is adamant.
Yeah.
And I'm sure if he doesn't play, he can still be part
role,
of
yeah.
part of the team. But as I say, I'm saying this totally from the outside and just
Absolutely.
my personal opinion.
Yeah.
So obviously we all want it to be,
yeah.
but they'll have their process and they won't take chances if it's
Love
not
that.
right.
Doc, it's so insightful chatting to you. You've got so much to offer the world of sport in South Africa, and I'm so grateful that you've decided instead of going, listen, I'm stepping away completely from the sporting stars and lights of our future stars and our current stars. You're still very actively involved in being a part of the sporting fraternity and community in South Africa, and your knowledge from sports medicine and from just the point of view of being there and having seen it all in your career. And I mean, you're still a spring chicken. You've still got plenty of miles left on the clock. But thanks very much for imparting with some of that information around some useful subjects over the past few podcasts.
Thank you very much.
Thank you very much. Dr. Konrad von Hagen with us, chatting all things sport-related around injury. We've had inflammation. Go and have a listen to that. We've chatted pain in this episode, and importantly, some of the medicines around dealing with whether it's inflammation or pain or any other kind of worries or concerns. Remember to like, subscribe, and join us for another Health Matters podcast next week. Proudly brought to you by Cipla.